fourth question, we'll start off with Mr. Carlson again. Would you vote to repeal or replace the health care bill? Why or why not?
I've already touched on that, but definitely I would repeal it, and that is because I believe with the new government that's going to be formed to fill in the power vacuum that's resulted from the crisis of leadership that we now have in Washington, I believe that we're going to be able to put something forward that's really going to save lives, going to address health disparities by reducing the gap between various races who are affected by these killer diseases like cancer, like heart disease, diabetes, lung disease. And I believe Obama's going to have to accept it. And so I think this is a matter of leadership. Now, I've signed the contract from America, and part of that is to defund, repeal, and replace Obamacare. And I totally agree with that. There's a lot of good things in that contract, and I can't wait to get there and get this done and start the country moving in the right direction again. Again, I've said as far as defunding, if there's some kind of a program that is saving lives, I would be willing to fund that program in exchange for a quick repeal of Obamacare. I think that is actually a tool that the Congress would have.
Thank you. Ms. Collette?
I actually prefer Congressman Price's formulation. We need to replace everybody that voted for Obamacare, then we need to repeal it, and then we need to reform the health care program. Obamacare is premised on the idea of government-centered health care, including the idea that government can control what we need and get in between our doctors and their diagnosis and our treatment plans. What we need to do is replace it with patient-centered care. We need to reconnect the consumer with their health care costs. I would be in favor of creating the same sort of tax treatment for individuals who purchase. Now, I'm not saying there's no role for government, because of course there is. We do need pooled insurance plans for small business owners. We do need them for people with disabilities. But we certainly don't need the comprehensive takeover of health care that has been attempted in this monstrosity.
Thank you. Representative McCollum.
I would not vote to repeal something that's very important to the state of Minnesota. There's a term that's used called geographic disparities, and I heard from doctors and patients and hospitals about how this hurt Minnesota. And I'll do this quickly. 3 seniors, all paid into Medicare the same. Siblings, one lives in Florida. Everything's covered, including the health care membership. Brother in Montana. Everything's pretty much covered, you know, no health care membership, but you know, everything's covered. A brother in Baxter, Minnesota has to work with his family in order to pay for his heart medication. That's a geographic disparity. For 30 years, members of Congress from states like Minnesota have been trying to change this inequity, which paid our doctors and our hospitals less, because we were more efficient with our health care. So they thought for some reason, with efficiency and good medical care that our doctors gave, our doctors should and hospitals should be rewarded less money. That affected the quality of care and the way that we could attract physicians into this state. I had my Mrs. Smith Goes to Washington moment. I got it repealed. I will not vote to repeal something that's so important for Minnesota, which treats our doctors and our seniors with dignity.
Thank you. Our next